or anything. I am just coughing on mute. So apologies for that. But thank you all so much for joining us today for our September Act and Learn webinar, Alternatives to Anti-Abortion Pregnancy Centers. So I will jump in and introduce myself and then pass it off to my co-host. My name is Jessica Ensley. I use she, her pronouns. I am the Senior Vice President of Outreach here at Reproaction, and I am based in Washington, D.C.
And I'm Anna Romano, she, her pronouns. I'm the Senior Research Coordinator at Reproaction, and I'm based in Atlanta, Georgia.
Great. So here's our agenda for today. I will introduce our organization. I will go into, pass it over to Annie to go into the topic overview before we get into our wonderful panel discussion. And then we'll take care of some housekeeping items and go to the Q&A. You can join our conversation by live posting at #Reproaction on Blue Sky. And if you have any questions throughout this webinar, please put them in the chat, and we will get to them at the end. So a quick overview. We here at Reproaction, we lead bold action to increase access to abortion and advance reproductive justice. We are known for our left flank analysis, our willingness to hold folks on all sides accountable, whether they be allies or opposition, and our commitment to nonviolent direct action. And with that, I'll pass it back to Annie.
All right. Hi, everyone. Thank you for joining us. I'm going to introduce us to the topic. Not going to spend too much time talking about what anti-abortion pregnancy centers are, but just wanted to do a quick overview. Anti-abortion pregnancy centers may appear as reproductive healthcare clinics that advertise free pregnancy tests, ultrasounds, or options counseling, but they actually exist to dissuade people from having abortions. These centers exist in every state, even those where abortion is legally protected, and the industry is incredibly well funded, with recent estimates sitting at about $2 billion per year in revenue. So we can look here at a report from the anti-abortion research organization, Charlotte Lozier Institute, and the major anti-abortion pregnancy center networks. And we see from their own data that so few are actually providing anything that we would consider to be reproductive health care. None of them provide birth control, nor will they ever offer birth control. Only 3% offered well woman exams, only 4% offered prenatal care, and only 28% offered STI treatment. So again, there's not a lot of reproductive health care happening at these centers, and yet supporters of anti-abortion pregnancy centers allege that they are viable replacements for reproductive health care clinics closing. On the right side, there's a report from the Charlotte Lozier Institute again that was published this past month about how there are allegedly alternatives to Planned Parenthoods. And they, of course, mention anti-abortion pregnancy centers as a viable alternative, despite us knowing from their own data that it is not a solid replacement. Next slide. All right, so after knowing all of these facts as we do, why do people still go to anti-abortion pregnancy centers? Thousands of people are visiting these centers per year. Of course, there are some that will be duped into going, thinking that maybe they're going to an abortion clinic, but there's also folks that are aware of the limitations of centers and the ideological backing behind them, who are still visiting anti-abortion pregnancy centers. So I think it's important to ask ourselves, why people are drawn to these centers and who is being drawn to these centers when we talk about how to combat them so that we can figure out how to meet people's needs in a way that is more supportive of all options and actual reproductive health care. So looking at this study here, this is from a few years ago, and it looked at, what women are seeking from anti-abortion pregnancy centers, which they call pregnancy resource centers in this particular study. The study found that out of the 273 first-time clients that went to the anti-abortion pregnancy center, their most frequent reasons for going were free diapers at 87%, followed by baby clothes and items, 44%. And then clients most frequently discuss parenting resources and referrals and counseling. Only 6% discussed pregnancy options and only 2% discussed abortion with the anti-abortion pregnancy center. And from this, the researchers conclude that the anti-abortion pregnancy center clients are mostly seeking parenting resources. But just something that I want to note too before we continue the conversation, these quote unquote free resources offered by anti-abortion pregnancy centers aren't truly free in a lot of cases. Many anti-abortion pregnancy centers provide things like diapers, baby wipes, and baby clothes through an earn while you learn type of program that requires parents to take pregnancy, parenting, and relationship classes in exchange for those material goods. But we have to be suspicious about the content of these classes. Anti-abortion pregnancy centers are the on-the-ground operation of the anti-abortion movement. They're known to support a narrow vision for family and life, including things like heterosexual marriage and abstinence. So The content of these Earn While You Learn classes likely serves that agenda, and it's unfair that clients should have to be subject to this messaging in order to receive support. Next slide. All right. So to build on this conversation more about, who is drawn to these centers or maybe even targeted by these centers, a more recent literature review also found that Black and low-income individuals are more likely to report having visited an anti-abortion pregnancy center compared to their white or middle and high-income counterparts. The researchers also conclude in this study that the quote unquote free parenting resources offered by the anti abortion pregnancy centers are what drew Black and low income clients into the centers the most. We know that anti abortion pregnancy centers far outnumber reproductive healthcare clinics, and that Black and low income individuals are more likely to live in areas with limited access to healthcare more broadly. So it may be easier for folks who are low income or who live in rural areas to get to an anti abortion pregnancy center than anywhere else. So that's also just something to think about when we're talking about who's really targeted by or drawn to these centers. Next slide. I think we're having this conversation at a really great time. The topic of pro-abortion alternatives to anti-abortion pregnancy centers has come up in the news recently. Just last month, Mother Jones published an article about an abortion fund in Arkansas that identified the need for material outreach in their community and actually ended up opening a pro-abortion pregnancy center with material resources, ultrasounds, and counseling, minus an anti-abortion agenda. Of course, the opposition responded pretty shortly after. This is an article from Pregnancy Help News, which is an anti-abortion platform. They published a response commentary in response to this Mother Jones article in particular about how this pro-abortion pregnancy center is quote unquote mimicking life-affirming care and how it's hypocritical for pro-abortion folks to open a pregnancy center when, we want to hold them accountable for what goes on inside their anti-abortion pregnancy centers. Obviously, there is a difference between a pro-abortion and anti-abortion pregnancy center model, namely that pro-abortion pregnancy centers won't impose a pregnancy outcome on people, and that the free material goods are actually free without strings attached. Next slide. And then just to close up, you're going to hear from our amazing guests in a moment, but I wanted to share with y'all first some photos of the outreach that our amazing panelists are doing. In these photos, you'll see they're handing out material goods like diapers, menstrual products, baby formula, condoms, as well as other information about reproductive health and anti-abortion pregnancy centers. I always like to end on something positive. So, just something to keep in mind, we may be outnumbered and outfunded by anti-abortion pregnancy centers, but, these photos are proof that there are definitely people across the country that determined to offer a better, more unbiased alternative to anti-abortion pregnancy centers, no matter what. So we're really lucky to be learning from them today. Hopefully it inspires us to, continue this outreach. I'll wrap up here and I'm passing it over to Jessica so we can hear from our first guest.
Thank you so much, Annie. So it is my pleasure to introduce our first panelist, Elaine Richard. Elaine has been a Grandmothers for Reproductive Rights volunteer activist for the past 8 years, motivating people of all generations to use their voices in the fight for reproductive rights and justice to assure that future generations do not have to relive what older generations experienced. Her activism dates back to the early 1970s, when she campaigned vigorously for anti-war candidates. After graduating from Rice University in 1976 and attending the 1977 National Women's Conference in Houston, Elaine worked as a client advocate at the Delta Women's Abortion Clinic in New Orleans, supporting clients through all phases of their abortion care. She continued working for social justice as a supervisor for children's case management services, insisting people be treated with respect and dignity in their everyday lives. It has been um, it has been in retirement that Elaine has found her passion. Elaine and her friends formed the Waterville Pop-Up Buddies and began protesting the local anti-abortion pregnancy center in Waterville, Maine, months before the Dobbs decision. For the past 7 months, Elaine and the Waterville Pop-Up Buddies have been bringing the GRR mobile to local community events, giving their community truthful and accurate information about anti-abortion pregnancy centers while providing free, no questions asked wellness items. After fighting for 50 years, Elaine is not giving up. She is determined to leave the world a better place so all people may live self-determined lives filled with hope for their future. Elaine, thank you so much for joining us today. Let me unmute you.
Oh, I just unmuted myself.
Okay,
So
perfect.
yeah, I'm not always really savvy on all the technical stuff. So as long as you can hear me. Thank you so much for the introduction, and actually, thank you so much for having us and highlighting what the Pop-Up Buddies are doing. Um, Briefly, GER is a pro-abortion culture change organization working intergenerationally through the lens of reproductive justice. We find that education and truth are our most powerful tools. The Waterville Pop-Up Buddies started doing pop-up demonstrations pre-Dobbs as a way to bring attention to the local AACs and keep abortion in the minds of the community. Here in Maine, we have 11 AACs with 3 legitimate regulated providers. So, unlike our teach-ins about AACs, which were getting us into the classroom, pop-ups were getting us on the streets talking with people. Once people realized that that very sweet little building on Main Street was actually a treasure trove of disinformation about abortions and birth control, and that they humiliated people for their decisions if the decisions didn't align with conservative Christian ideology, and that people's personal information was not protected by HIPAA, people were blown away. And actually, that learning about the lack of privacy and HIPAA really sent at that time people right through the roof. We decided to literally take to the streets and bring truth to the people who were being targeted by the AACs, hence our Mobile. We created a pregnancy resource guide giving all the options for pregnancy, abortion, adoption, and parenting in one easy to read brochure. And we included how to avoid anti-abortion centers by naming them and where they were located in Maine. We decided to give away free stuff as a way to start our conversations with people on the streets. We thought AACs, anti-abortion centers, give away free stuff, but so do pop-up buddies. We chose repro wellness items including pregnancy tests, condoms, Plan B, menstrual pads, tampons, diapers, diaper wipes, all free with no need to explain why one needed them. There was no shame, there's no stigma. You need them, you take them. We could give away diapers just as easily as the AACs, and we never ask why you need them. We now realize that the giveaway items are as important as the brochure because by being on the ground, talking with people while giving away our items, we are spreading the word about AACs in a very non-threatening way, and we are helping people with sustainable items, no questions asked, and again, no shame, no stigma. We hold house parties to inform people about AACs and ask only for giveaway donations in return. And as you can imagine, nowadays people are very, very generous. So with our car magnets on our cars advertising the GER giveaway, our giveaway items, and our brochures, we head out to places we feel AACs target: community events, the local soup kitchen, food giveaways, and substance use treatment centers, as well as colleges and universities. We have been asked and have tabled at various community resource fairs. We set up shop at First Friday events, Pride events, college resource fairs, residential recovery programs. The community action programs have invited us to community baby showers where we make gift bags of all our giveaway items. And we greet folks really simply with, "Hi, I'm with Grandmothers for Reproductive Rights. We're a pro-abortion culture change organization, and today we're giving away all this stuff for free." Every event connects us to another group who wants us to come and share what we are doing. And we get no negative feedback at the events because we are engaging people in honest one-on-one conversations. And honestly, it's because we are grandmothers. Pop-up buddies, grandmothers, and grandothers are being embraced by the community as sources of truth when it comes to abortion access and care, as well as all repro healthcare. We also are trusted to share information about resources for all options related to pregnancy. We are developing partnerships with groups that never, ever thought they would partner with a pro-abortion group: community action programs, church groups, and community food pantries. And we all think that that's pretty cool. We've also learned that what we are giving away as repro wellness items also provide some very basic needs for people. So for instance, diaper wipes to stay clean when someone is unhoused, diaper cream for various rashes for people of various ages. I want to just give you a really quick example that since mid-March, we have given away, mid-March of this year, we have given away 1,300 pregnancy resource brochures, 2,100 diapers, 1,700 condoms, 550 pregnancy tests, and hundreds of packages of Plan B. And we continue to stand weekly in protest against the local AACs here in Waterville. So that is what we are trying to do to pivot people away from the anti-abortion centers.
Thank you so much for that wonderful overview, and all of the resources that you have been able to provide, seemingly just within this year. That's such great news. I want to ask you, so even though Maine has legal protections for abortion, why is countering the anti-abortion pregnancy centers in Maine so necessary?
Yeah, so like everywhere countering AACs, it is essential here in Maine. We know, as you said earlier, that anti-abortion centers are the boots on the ground for more than the anti-abortion movement. To me, they're the boots on the ground for anti-everything reproductive justice movement. And one of the tenets of reproductive justice is the right to bodily autonomy. And in this climate of authoritarian rule, bodily autonomy is at the heart of all the issues. So we feel that we are trying to help people understand the connection between our giveaway and what is being taken away. And here in Maine, abortion, it's not codified in the Maine Constitution. So we know that it takes a stroke of a pen or a vote in the legislature to change what we have. And though public opinion is on our side, there are bankrolls from national anti-abortion centers that are continuing to fund the campaigns here in Maine to end abortions of any kind, and they fund political campaigns overtly or behind the scenes. We ask people to check with their school board members or city councilors, state reps to find out where they stand on abortion access and rights and to hold them accountable. At the same time, I think we have to be mindful that in these times when hospitals and healthcare providers are being shut down all over Maine, and we are a really physically large state as well as very rural, when access to basic healthcare is dwindling and when the government is creating healthcare deserts, people are often drawn to places that say they will meet their needs, but the AACs pry on the people who have these needs, and it's our job to keep people informed. We feel that pop-up buddies armed with the truth, with honest, practical information and needed items available, free, with no explanation needed, must be our frontline workers in our community to counter the AACs here in Central Maine.
Absolutely. I think that's so important to keep in mind, the ruralness of Maine and some of the um, medical deserts that exist out there, and folks, are looking for care and do need to be taken care of at various points, and so they might be more easily led into an anti-abortion pregnancy center. Something I think about often is when I was in college, and this was pre-Dobbs, when abortion was legal in my state, and a friend of mine needed Plan B and went to the location right near campus that just had a sign that said free pregnancy tests, assuming that they would be able to provide that or at least give some guidance on where she could find it. And instead, she got a lecture about how not to have sex, and left feeling very ashamed. And so I think it's very important to keep all of that in mind. And so wonderful that an organization like yours exists, to give people the products that they're looking for at no cost. Um, can you share? You mentioned broadly some of the conversations that you've been having and some of the success stories. Can you share any specific ones where you've either changed somebody's mind about anti-abortion pregnancy centers or taught them something new about the work that you do?
I would love to, and I think it goes both ways. We're teaching, but we're also learning at the same time. But before we created our pregnancy options brochure, we approached our local community action program because we wanted to include them in the brochure. The community action programs here are like the providers of family home visits for new families, Head Start, transportation needs. They cover the whole gamut of stuff. So we really wanted to be able to include them in our brochure. So while we were waiting to meet with them, I checked out their brochures and found that they were advertising one of the AACs as a resource for diapers and baby stuff. So I thought, well, after our presentation, I pointed that out to them. I have to say that our presentation, they were sold on being part of what we were doing. So I pointed this out to them. They jumped up from their chairs, grabbed the brochures. They said they would never, they would remove that from the brochure so that they would not be giving out false information. And I think what this proved to us was that very well-intentioned, community-focused people were not aware of the AACs, and it made us even more resolute of what we needed and wanted to do. And we continue to have this most collaborative relationship with the community action programs. They invite us to all their resource fairs, and they continue to generously provide us with as many diapers as we can possibly give away. And the other thing, if I just have a real quick minute, is that one of the teachings we did was at a residential recovery program. And one of the participants there said she had been to the local AAC and they didn't indeed give her 6 diapers, but she had to sit through 4 hours of their Christian indoctrination. So the next time she went food shopping, she needed diapers and she couldn't afford the diapers and the food at the same time. And she said to us that she had decided she would never again sit through 1 more hour of shame and humiliation for diapers. So she stole the diapers. And I use that example all the time because I think it's important for people to understand the needs that people have. And no one ever passes judgment. No one bats an eye. No one says anything. So that helps me learn and know that we are really reaching people and we are providing something that is really needed. You know, it's about mutual aid. And for me, this is a win-win for all of us.
Absolutely. And the non-judgment part is so incredibly important, and something that anti-abortion pregnancy centers just do not offer because that is the basis of them. So, th Elaine, thank you so much for overviewing the work that you've done within the past the past decades, but more recently, all the work you've done in Maine. It's super important. And if folks have questions for Elaine or our other panelists, please feel free to enter them in the chat and we'll get to them at the end. Elaine, thank you so much.
Thank you for having me.
All right, and with that, I will pass it over to Annie to introduce our next panelist.
All right, thank you, Jessica and Elaine. I am pleased to introduce Roxanne McNellis, who uses she, her pronouns. Roxanne McNellis serves as the Director of Public Affairs for the Women's Centers, a group of independent abortion providers located in Connecticut, Pennsylvania, and in New Jersey at the Cherry Hill Women's Center. For the past decade, Roxanne has supported people seeking abortions and facilitated educational, political, and volunteer opportunities for community members. In her role with the Women's Centers, Roxanne works to break down misinformation and stigma surrounding abortion care while advancing opportunities for clinical training and research. She is deeply committed to building strong coalitions and cross-movement partnerships, envisioning a future where everyone can access reproductive health care when we need it, laws that support each of us, and all pregnancy options are met with love and support. Roxanne, thank you so much for joining us.
Thanks so much, Annie. I'm so glad to be here.
Awesome. All right. My first question for you is about misconceptions about abortion clinics. Many people may think that abortion clinics, like the women's centers, only provide abortions. Can you talk to us about what other services the women's centers provide and, what differences in care will someone find at an abortion clinic versus an anti-abortion pregnancy center?
Absolutely. So at the Women's Centers, we are a network of independent clinics. We have sites in Pennsylvania, New Jersey, and Connecticut. And at our core, we specialize in both medication and procedural abortion care. And there's nothing wrong, right, with being a specialist or with not offering every possible healthcare service at every single site or under one roof. But the reality is that's really only part of the picture of what it is that we do. So each of our centers' services are shaped by state laws, the type of facility, and the needs of the community. So, for example, our Cherry Hill Women's Center in New Jersey is an ambulatory surgical facility that can provide abortion care later in pregnancy and can support individuals who are coming to us from within the state or who are traveling to us from outside of the state for care, and we frequently do support individuals in that way. In contrast, our Hartford GYN Center in Connecticut is licensed as a family planning clinic and offers a full range of sexual and reproductive health services. Now, at all of our sites, patients have access to unbiased, non-directive pregnancy options counseling, ultrasounds, and contraceptive counseling and care. We also maintain strong referral networks for healthcare coverage, parenting or adoption support, housing, food security, and more. Now, the majority of people who come to us are very confident in their decision to end a pregnancy. But the reality is that most of our patients are parents already. And those who feel unsure or who choose to continue their pregnancies still benefit from accurate information and the community connections that we can provide. We provide pregnancy options counseling training, in fact, to healthcare and social service colleagues in our community. Something that we've found is that folks who work with individuals with the capacity for pregnancy are frequently uncomfortable supporting ambivalent pregnant people, which too often leads to referrals to anti-abortion centers, which can mislead people, withhold information, or pressure them toward one certain outcome. And at the women's centers, we operate from a very different foundation, respect for autonomy. We trust our patients to make the decisions that are right for them. And our role is to offer care, compassion, and resources that really meet their unique needs, whatever their situation may be. Our mission is not just to provide healthcare, but also to strengthen communities, to build a better future where people can access the care and the support that they need. And I think that, that differentiation of not having sort of stake in the outcome and really just providing people with as many resources, as much support as we can, as much information as we can to help them get where they're going is what truly sets us apart.
Yeah, thank you for highlighting the breadth of resources and services that y'all provide. My next question is about how anti-abortion pregnancy centers have impacted the work of abortion clinics, like the women's centers. If there's any stories from your experience about how they've interfered with your work or with your clients that you've heard or seen, we'd love to hear.
Yeah, so I've worked with the women's centers for nearly 13 years now, and I've held, every position from answering the phone and scheduling appointments to supporting people directly in their care in clinic, and now, in more of the community. And during that time, I have seen a consistent impact that anti-abortion pregnancy centers have had on our work. And when I thought about this, I have to say that the most direct way is through the widespread misinformation. So from billboards that make false claims to misleading websites, posing as sources of medical information, to more high pressure tactics like leafleting or even parking ultrasound vans like right outside of our clinic doors. I would say that almost every patient that we care for has encountered these stigmatizing and what are sometimes frightening messages. So, in one really extreme example, an anti-abortion center opened up inside the medical care complex of our Hartford GYN Center in Connecticut, which ultimately resulted in us needing to move our center to a new location due to the level of harassment and that our patients and our staff faced. So, we, as abortion providers, have historically faced significant violence, which results in us having security protocols that include things like locked doors. The anti-abortion center that opened up just 2 arms lengths away from our front door would prop their front door open and have a volunteer staged outside with a white coat that was literally corralling people into the office. And we heard frequently from people who were, made to hold baby dolls while they were given ultrasounds by non-medical staff. And we're told things like, if you proceed with your appointment at Hartford GYN Center, you may not make it out alive. The state and the city of Hartford, in fact, moved to pass some helpful legislation that reduced the use of false advertising for these centers, but it didn't keep them from impacting people directly on site. And I think that's something that we don't often make the connection of is, it's not just anti-abortion crisis pregnancy centers online or, on their physical locations, which tend to be located very close to clinics like ours, but also the fleets of volunteers and sometimes staff that they present directly outside of clinics that often shout or use video recording or things to intimidate patients who are seeking care. And, what we know in reality is that abortion is both common and exceedingly safe. Generations of people have benefited from abortion access. And the research shows that overwhelmingly, the majority remain confident in their decision years later. But this constant drumbeat of disinformation from anti-abortion centers shapes how patients and their families perceive abortion care and abortion providers like us. It truly breaks my heart when our patients tell us that they were surprised that our clinic is welcoming or that our staff is kind or that their care exceeded, their expectations. And that surprise is just the result of years of false narratives designed to stigmatize and shame. And what I know to be true, and I'm sure you do as well, is what they experience inside our centers and at clinics like ours is what every person seeking care deserves, which is compassion and dignity and high quality medical services.
Yeah, thank you for sharing that example. I think, yeah, like a lot of the time, we have these talking points about anti-abortion pregnancy centers and they're powerful, but I think the impact of just these like facts that I was saying in the introduction is just amplified by like the real life stories from people that are in like the direct service space. So thank you for sharing that. That is a really scary example. I have one last question for you for now, just about we talked in the introduction that people may be enticed by anti-abortion pregnancy centers, advertising, so-called free services. What do you wish that people knew about how to access affordable reproductive health care? Whether that be, how to access reproductive health care, whether it be, gaps you've noticed or anything you'd like to share about like access and affordability.
Yeah, so it's definitely true that many people are drawn in by the promise of so-called free services. But the truth is that those free services certainly come with a price, whether it's being coerced or shamed or misled about your options, or even having your healthcare information threatened. And what I want people to know is that it doesn't have to be this way. In Pennsylvania, we are very proud of Governor Shapiro and his administration for disrupting decades of funding to anti-abortion networks that over the years resulted in a 9-to-1 disparity of anti-abortion centers to abortion providing clinics like ours. And now, instead, the state will direct those funds to organizations that meet the true need in our communities. So I saw some questions about like where funding is coming from. I think this diversion of funding is a really great example of what's possible. And every person, regardless of their circumstance or where they live, deserves affordable, compassionate care that is in their community. But unfortunately, bans and funding cuts have reduced access to reproductive health care across the country. And I want people to know that there are incredible networks of support, clinics like ours, abortion funds, and practical support organizations that are working every day to make sure that you can get the care that you need in a way that is both affordable and accessible and also affirming. And, at the same time, we really can't ignore the bigger picture, like wealth disparities, unaffordable housing, lack of basic household resources like diapers, and the constant threat of surveillance and incarceration and family separation are only getting worse. The solutions, that we are implementing, things like collaborating with organizations such as the Maternity Care Coalition, who you're going to hear from, make a difference for the families that we serve in the immediate term. But, the broader work really depends on strengthening our communities through policy, advocacy, education, and solidarity. And it requires of us to support broader movements for racial and social justice because reproductive freedom cannot be separated from those struggles. And I really do encourage people to seek out trusted networks. National Abortion Federation, Abortion Care Network, those, both maintain directories of real abortion clinics. Um, Places that are committed to safety, dignity, accurate information. I can't stress enough the importance of being savvy about where and how you share your personal information. And I think, I'm seeing the activists and advocates in the chat asking about strategies. In New Jersey, we have been working to disable crisis pregnancy centers' ability to um, remain prominent and access or gain access to people who are seeking services that they do not offer in the way that they misrepresent themselves by distributing accurate information and actually consumer alerts from the Department of Consumer Affairs, from the New Jersey Office of the Attorney General, that they have translated in multiple languages to make sure that people have a clear, trusted or resource about what these are and what is actually happening so that they can make informed choices for themselves. And yeah, I just want people really to know that they deserve care, that meets their needs, that honors their decisions and protects their privacy, and that we can fight for better systems that don't rely on people having to navigate these kind of like weird, stigmatizing and often very damaging systems.
Thank you, Roxanne. That was a really inspiring conversation and hope to hear more from you in the Q&A.
Great. Thank you both. I will now introduce our last but not least panelist. Alexa Troutman is the Community Engagement Services Program Manager at Maternity Care Coalition, where she leads initiatives that strengthen community relationships and advance equitable outcomes for families. With a strong passion for advocacy and policy, Alexa is dedicated to creating meaningful change within the nonprofit sector. She received a bachelor's degree in public policy from the University of Delaware. Alexa, thank you so much for joining us today.
Thank you so much for having me. I'm very excited to be here. I also wanted to say I forgot to put my pronouns in my introduction, so I use she, her pronouns.
All good. Thank you so much. My first question for you is, can you share with us a little bit about what the Maternity Care Coalition is and what you all do?
Of course. So, Maternity Care Coalition is a community-based nonprofit organization. We serve 9 counties in Pennsylvania, and we also are in the state of Delaware in the prison system. We were founded as an advocacy organization in Philadelphia back in 1980, in a response to the appalling rate of infant mortality in the region, specifically focusing around Black and Brown communities. Our mission here is to improve the health and well-being of pregnant women and parenting families and to enhance school readiness for children ages 0 to 3. And we do this through our completely free and voluntary programs. So we offer around 8 different home visiting programs where we go out into the home and serve our families by supporting them with connection to external resources, applying to any benefits they may need, some parenting education in the home. We also can help them get connected to our Cribs for Kids program where they can receive a free pack and play. In addition to our home visiting programs, we also have parenting education classes that we offer incentives for. We also have center-based early childhood education, behavioral health, and mental health programs. We also offer essential products at all of our offices and at all of our outreach events. We also support our families through our work with research and evaluation and our policy and advocacy team, who's currently working towards having paid maternal leave throughout all of Pennsylvania. So as I said earlier, our programs are free and voluntary, so we're very low barrier to entry, and we don't take any insurance requirements or any identifying information besides basically what we need to meet and serve our clients. So we need like their zip code, their location so that we can come out for our home visits. We also serve any undocumented citizens that are comfortable with joining us and our services, which I found important to note just with the recent state of our country with ICE heavily in our communities. We have seen a little bit of some restraint on that end of people not wanting to join us, but we support all of our clients.
Awesome. That's so important on that last point. Thank you so much for sharing that with our audience. So you are in partnership with the Women's Centers. Can you share what inspired that and what that partnership has done to impact the community?
Yeah, definitely. I was very excited to partner with the Women's Center. So when Roxanne and I were able to connect, we had a great conversation about the women that come to the clinic. And she noted that a lot of the women that come to the clinic have other children and could really use our support through our programs and our products, as well as we offer menstrual products. So that helps with the aftercare from a medical abortion. Um, so our partnership was inspired by our goal to support all women and birthing people, no matter their situation. At MCC, we support our all birthing people's right to choose, and we want to meet people right where they're at and give them whatever support that they need. And we don't want to step into their autonomy and their choice. So I thought it would be a great partnership to show others how to give tangible support for those in this situation rather than any other like negative pushback. So far, the community at the Women's Centers have really enjoyed our support. We have given out over 150 products just at the Women's Centers. In our other partnerships this past year, we have given out thousands of products. We give out diapers, wipes, tampons, pads, pregnancy tests, any other reproductive health program products that we have on site. We'll bring and give out to the community. And I think it's had a great help. And another thing that we've been doing at the Women's Center specifically is just making sure that they get our information and our brochures without pushing them to enroll in anything that day, just because being there on that day is an emotional experience and they're probably already pretty drained from what's going on. So we want to be able to give them the access to our resources without having them feeling pushed towards enrolling in anything that day.
That's very important and leads me into my next question, since anti-abortion pregnancy centers do tend to pressure people to sign up for things in order to get resources. So as someone who works at an organization dedicated to improving maternal and child health outcomes, what do you make of anti-abortion pregnancy centers that claim that they are a viable alternative to reproductive health care clinics?
So, I'm glad you asked. As someone that is working to improve maternal and child health and at MCC as a whole, we believe that it's critical that care is rooted in medical accuracy, transparency, and patient autonomy. So, we believe that every patient should be educated on all of their choices and be able to make that choice on their own without pressure. We advocate for evidence-based care, and all of our home visiting programs are evidence-based and backed. We also believe in a parent's right to choose what's best for themselves and their families. Anti-abortions pregnancy centers, as stated before with our other panelists, often lack licensed medical staff and can provide misleading or incomplete information, which would then undermine the informed decision making for the patient and can delay access to timely care. So, because of this, we do not feel that they are a viable alternative to comprehensive reproductive health care. And in fact, they pose serious risks to the well being of the people they claim to serve, which is why, again, like I said, I think our partnership with the Women's Centers has been really important for our community to see that there are other choices and there are ways to go about your pregnancy where you can have informed decision making from medical professionals.
Great, Alexa. Thank you so much for giving us an overview of the work that you do and for taking the time to speak with us.
Of course, thank you so much for having me again.
Of course. Great. So we will head into a couple of housekeeping items. I see we have some questions in the chat. If anybody else has questions, please feel free to enter them in. We will get to them in a moment. So just note that you can plug into future Reproaction campaigns at reproaction.org, or you can follow us on social media. We are at Reproaction everywhere. And you can stay tuned for our next webinar by signing up for our email list, which where we send those invites to. All right, so to the Q&A section, we received a bunch of questions for Elaine, and that is, where do you get funding in order to provide all those wonderful resources for your community? Is it fundraising, individual donors? How do you go about doing that?
So, it's a really good question because funding is what will keep us going, as well as our energy. But what we found was we looked at what we needed, and then we tried to find resources that we could get these from. So all the condoms that we give away, we get donated to us by the Maine Center for Disease and Control. We have a really good relationship with them for that. We have a relationship with Plan B, so we're able to access Plan B um, to give away as well. And the Community Action Program, like I said earlier, gives us as many diapers as we possibly can give away, also for free. What we did when we first started off as well was we started to have house parties. We would ask people who were in the pop-up buddies, invited friends and family to their home. And I talked about anti-abortion centers, and all we asked for in return was donations of the giveaway products. And at that time, I mean, people were giving us pregnancy tests, they were giving us tampons, they were giving us pads, we were getting diaper wipes, diaper cream. We also, because of our partnership with the soup kitchen here in Waterville, they were given a donation of thousands of tampons, which they couldn't use. So they donated that to us for us to use. And we find that whenever we're running short of something, if we just talk to the pop-up buddies and their friends, we get the donations. We have since found some really good companies that are able to provide us, where we can get really good deals for the products that we need. So people are able to either donate products to us, or they can go online and order something and have it sent to us. They can donate money to us and we can go buy those products. But it's all through donations, or as I said earlier, the free products that we get from the Community Action Program, from the Maine CDC, and from Plan B. I hope that answers that.
It did, and it's such an awesome example of community organizing for the greater good. That's awesome. Thank you so much. I want to pass it over to Alexa if you have anything addition to add on how you all source your products in order to give them to folks.
Yeah, definitely. So we receive our funding through a few different streams. So we receive contracts from the government that fund our programs. We also receive donations from larger organizations. We also have grants through private and public foundations. We also have sponsorships through larger corporations and their foundations arms. And then we also receive donations from individuals. So you can always go to our website and there is a section where you can donate if you are interested. But our largest stream of funding comes from grants and the government.
Awesome. Thank you very much. Um, okay, our next question is for Roxanne. And that is, Roxanne, you mentioned state law in Connecticut prohibiting deceptive advertising. That's resulted in reduction of false advertising by anti-abortion pregnancy centers. Did those centers, were there complaints? How did that, do you have any context for how that state law came to be?
Yeah, so the city ordinance and state law around deceptive advertising practices was truly driven by the experiences of individuals who came into contact with anti-abortion crisis pregnancy centers within our state. So when it was initially called the St. Gerard's Medical Center for Life, it rebranded as the Hartford Women's Center when it moved in next door. And we found ourselves in need of a clinic escorting program to have volunteers help walk people into the front door. We had some great support from the organization Abortion Access Front, who actually helped, paint our walkway yellow to help people see where it was that they needed to go. And we had support from what was then neighborhood pro-choice Connecticut, which today has merged with Reproductive Equity Now in the Northeast, or REN, to build out that clinic escorting program. And with it, some story collection. So we worked directly to gather testimony from the impact of individuals who had been corralled into the anti-abortion center or who had otherwise been disrupted from receiving care, or who were faced with this type of or disinformation. And it was happening with such frequency because of the extreme nature of the anti-abortion center kind of parking themselves directly next door to our office, that it made a really compelling case for why this was necessary. I will say that the deceptive advertising practice bill was purposely crafted to ensure that it would maintain court challenges. Unfortunately, there are a lot of limitations around, how the anti-abortion centers sort of can be regulated because they offer their services for free and because they are actually not medical. They generally go without much oversight at all. And so this kind of deceptive advertising practice approach was meant to close a gap in the CUTPA, which oversees kind of the regulation of services that people might pay for commercially. And so it didn't do everything, right. It didn't keep them from chasing people up to our front door. We still had to move, but it did impact the advertising a bit. Today, anti-abortion center websites within this state have to have disclosures that they don't provide abortion care or refer for abortion care. But I will say that once attention was brought to the fact that they were misrepresenting themselves, many of these centers caved to public scrutiny and, had their own funding and donors, hold them to account for the way that they were representing themselves. So even if a policy, around them isn't possible, I would say that even just the kind of public conversation and public awareness around what is happening is very impactful. It can help to drive change in the way that they are operating when there is some level of accountability.
That's very true. And thank you so much, Roxanne. There were pamphlets. Again, this was like over a decade ago, back when I was in college, of a local anti-abortion pregnancy center that was very slut-shamey and very gross. And it wasn't until student activists complained about that one specific pamphlet that they took it down. So, yeah, definitely naming, shaming, and having conversations with the community about what these organizations do can help provide some protection. And thank you for flagging too that your center was the Yellow Brick Road one, because you weren't kidding. Insanely close. I'm so sorry you had to move. Absolutely ridiculous. Um, but glad you found a new location. This next question, I think Annie, you might be able to answer. And if not, I'll open it up to the panelists. I can't think of a specific answer myself. And this was the question is, I recall years ago there was data for those who actually did get material assistance from anti-abortion pregnancy centers, and it averaged out to be something like $17. Are there any current national data on the value that is supposedly given for free?
Yeah, that's a really good question. Let me think. This sounds like something from the anti-abortion research organization Charlotte Lozier. It seems like something that would be in the same report that I pulled, kind of the evaluation of like what services are actually offering. I think there's like a study on that sort of thing where like how much are we evaluating our services for. That is from like an opposition stance versus, from like a pro-abortion advocate stance. But that's kind of what's popping into mind, and I can share that with Cheyenne after.
Great, thank you. And we have time for one more question, and this is from Britt, a reproductive rights activist in Wyoming, also a very rural state. They note more than half of the counties don't have a practicing OBGYN and seeing a ton of anti-abortion pregnancy centers cropping up. The state legislator is proposing legislation to protect those anti-abortion pregnancy centers from regulation, and we're doing the best to educate the public on this. And they're asking for examples of effective ways to oppose legislation like this in other states. My one recommendation would be testimonials, if that is happening, of people who've been negatively impacted by anti-abortion pregnancy centers. But I also want to pass it to our panelists. If there is anyone who would like to go first, please go ahead.
Well, I'll take a stab at it because we are very rural. And what we found is that by organizing those of us who we've organized a lot, and GER and the pop-up buddies have made a big difference in a lot of the legislation. It's so important to show up at the state legislature and let people know that the legislators, your state reps, that they are not alone in the support that you're hoping that they're going to give you. I think what we found was that many people were almost willing to cave until we all showed up and showed that we had their backs as well as they're having our backs. So I think fighting against this legislation is really possible. You just need to show up. Testimony is really good. Being there is even more important. So that's the most important thing I think that we found as GERS, and that's what we were able to give, and it's been very worthwhile.
Thanks, Elaine. I think all of that is right. And I will also say that diverting funding to these anti-abortion centers is an easy out for lawmakers who are cutting off access to care, right? Those counties in your state have less and less access to, OBGYNs and reproductive health providers, likely because of the restrictions that are being placed on them or the limitations of the resources that are being provided in that area. And so I think finding examples of organizations, many of whom are likely, unfortunately, underfunded or under-resourced, who are doing the work to address maternal and infant health outcomes. There are often, smaller nonprofits, things like that you can point to just to show them like there are other opportunities, there are alternatives, and this is where we would like to see the resources or funding directed.
Wonderful. Thank you all so much again for taking the time out of your busy schedules to educate our audience and share your expertise. We really appreciate it. And thank you to our attendees for joining us today. I hope you all